Okay, so here's my spiel on explaining the evaluation process to the new patients. So I'm going to talk to you just like, or talk to the camera or the air as if I'm talking to the actual patient. Um, so the evaluation has two parts. First, we're going to take a look at kind of overall full body, big picture stuff. So kind of similar to what you would experience with an orthopedic physical therapy assessment. So we want to see basically all the things that are going to play into what's happening at your pelvis. So we'll look at your posture. We'll see how your back and pelvis are moving overall. Have you do some movements like squat, balance, hip mobility. We'll probably look at the breathing because that really plays into what it is you're experiencing with the leaking with coughing and sneezing. So we'll take a good look at that and your abdominal strength and coordination. So we'll get a kind of a big picture look. And then we'll, the other part of the evaluation is looking specifically at the pelvic floor muscles. So just to kind of give you an overall sense of the anatomy, this is looking at the front of the pelvis. Here's the pubic bone, the sit bones, the hip joints, around the back where the pelvis meets up with the sacrum. The spine is above it, and then the very bottom is the tailbone, which is important because it connects to all of the pelvic floor muscles directly or indirectly. There's some ligaments that are going on here, but mostly, that are going on here, but there's also the pelvic floor muscles that are kind of giving some of the structure. So then looking at the perineum, just to orient you, the clitoris, the urethra, the vagina, and the anus, and then the red you see is all the pelvic floor. So it's lots of little muscles as well as fascia, blood vessels, connective tissue that all plays into is a part of the pelvic floor. So it's responsible for a lot of things. One of the things is maintaining continence, so that's closing the urethra and the anus and only letting them open when we want them to. The other thing is they help with supporting these internal organs. So, and I will go into a little bit more detail specific to that person's evaluation or whatever their diagnosis is, but that would be an example for an incontinence patient. And then they support the organs. So inside the pelvis, the bladder, the uterus, and the rectum. And these deep muscles help to support the muscles in addition to ligament support. So there's a couple different ways that we can assess the pelvic floor function. One is we can look at them and assess them externally. So that means we are palpating those outer muscles externally to feel for, is there tension? Is there any laxity or too much movement? Is there tension more one side than the other? And then we can also get a sense for when you do a pelvic floor contraction or do a couple of maneuvers, what do your pelvic floor muscles do? We can also assess them internally. So that's similar to a gynecological exam, but we don't use a speculum. So it's a manual exam using just a manual exam using a finger to see on each side, is there tension? Is there weakness? We can get a good sense for the strength. And those are kind of the ways that we can kind of get a picture of what's going on and how that's playing into your symptoms. So what sounds the best to you? And then I'll let them answer. Most often they'll say like, oh, I want you to get as much information as you can. So, and if there's any hesitancy, then I'll always say, and just so you know, we can do neither of those today, or we can do external and then we can defer the internal to next time. And then that's it. And then just wait and see what they say. So hopefully that helps. And I think just coming up with your spiel for how it feels comfortable to you and makes the most sense to you, and then just practicing it over and over again, I think I've definitely done quite a bit of practice, and definitely probably fumbled through my words many times. But I think the more you kind of just practice it and get comfortable with it, and just then, even if you're a little nervous, you just kind of go back to that automatic script that you have.